just completely disconnected from the internet, so I apologize. I am going to just pick up where I left off. I am so sorry about that. So if there was anything in the chat or the Q&A at this point, I did not see it. Resend your questions. I am so sorry, guys. Thank you for sticking around. Okay, so at this point, we are talking about diabetes, different types of diabetes. Type 1 must be treated with insulin. Your pancreas is not producing insulin. Type 2, your cells are resistant to insulin, and that may be treated with oral medications and can be greatly impacted by your lifestyle, your diet and exercise. Diet and exercise do not have any cause or effect relationship with type 1 diabetes, but can certainly make an impact on how well your blood sugar is controlled. And then type 1.5. This is a less common type of diabetes that you may or may not heard of. So this is latent autoimmune diabetes in adults. So this has characteristics of type 1 and type 2. You may have heard of people originally being diagnosed as type 2, but eventually finding out that they are not, in fact, type 2, they're type 1.5. So it is also an autoimmune disease that attacks the insulin-producing cells in your pancreas. This affects people typically between the ages of 30 and 50. It's often misdiagnosed because the symptoms start off as characteristics of type 2 diabetes, but then over time, not responding to oral medications or lifestyle factors to the extent that it had been, leading to a different diagnosis. About 4 to 12% of people who initially received a type 2 diabetes diagnosis end up having this type of diabetes, type 1.5. Gestational diabetes affects women who are pregnant. So typically diagnosed in the second or third trimester of pregnancy, and it's a result of hormone changes that can lead to insulin resistance. This affects about 2 to 10% of pregnancies. If you've had gestational diabetes, your risk of developing type 2 diabetes is greater later on. Okay, so moving on to lifestyle management. We're going to talk about all of these different things from diet, exercise, weight loss, if that's applicable to you, medication management, getting enough sleep, and managing your stress. So as a dietitian, my biggest expertise is talking about diet. And this is the area that often people have the most questions, concerns, and often misunderstanding. So when it comes to diabetes management, carbs are not the enemy. We need to have a good understanding of carbohydrates, but not fear them or drastically reduce or eliminate carbohydrates. That's not necessary. But we're going to talk today about balancing your meals and making sense of carbohydrates. So one thing that I'll be talking about is the My Plate guideline, which helps with giving you a visual for how to balance your meals. What this says is that about half of your meal should come from non-starchy vegetables. Non-starchy vegetables being just about everything that's not potatoes, corn, peas, or winter squash. So everything else, leafy greens, tomato, carrots, broccoli, cauliflower, pretty much any other vegetable you can imagine to be the majority of your meal. That's going to give you a large volume to help you feel satisfied. And then about a quarter of your plate should be a protein source. With any meal or snack, we want you to have some kind of protein along with your carbohydrate. And to balance your plate, we want about a quarter of your meal to be your starches, whether that's bread, pasta, rice, potatoes, or other starchy vegetables. Alongside that, you can also have one serving of fruit and a serving of dairy if you choose, but the emphasis here being on having the non-starchy vegetables make up the largest portion of your plate to help give you the volume of food that you need to feel full and satisfied, rather than just saying, eat less of the starches, the things that are really easy to overeat, like bread, pasta, rice, and potatoes. It sounds good in theory to just say eat less of those foods or to keep the portion small. But in reality, in order to do that, we need to make sure you have other things to help fill you up and satisfy you, including the protein and the non-starchy vegetable. So we're going to talk more in detail about limiting things like added sugars, refined grains like white breads and things like that, foods that are high in saturated fat, and foods that are excessively high in calories like sweets and sodas and candies and things like that. Emphasis on the word limit, not eliminate. Nothing is entirely off limits, but we need to really have an understanding of how those carbohydrates add up and how that can impact your blood sugar and what numbers make sense for you. So I won't be able to go into specifics about exactly how many grams of carbohydrates to consume, but I will give kind of a general overview. For the purposes of this presentation, let's say we're going to be looking at a carbohydrate goal of about 45 grams per meal. Depending on your overall calorie needs, your height, weight, physical activity level, whether or not you have a weight loss goal, etc., will all kind of go into play when it comes to figuring out that exact number and what's right for you. But for our purposes today, we'll say that the goal is about 45 grams of carbohydrates per meal. So keeping in mind, we are not fearing carbohydrates. The goal is not to eliminate carbohydrates. Carbohydrates are in almost every food we consume, with the exception of meat and fat, like oil and butter. Even non-starchy vegetables have a small amount of carbohydrate. So it's a big category, and it includes lots and lots of good, healthy foods. So you'll see here, we're talking about whole grains, pulses, which are beans, lentils, and peas, starchy vegetables like potatoes, sweet potato, corn, squash, etc., fruit, and dairy. Those all belong in the carbohydrate group. So again, we're not eliminating, but we are going to keep an eye on how they add up and learn how to count and accommodate for total carbohydrate intake. So there are simple carbs and complex carbs. Simple carbohydrates are made of one single sugar unit. They are able to be digested quickly and can cause your blood sugar to rise a bit more quickly if they're consumed alone. I mentioned before, whenever you're having a meal or a snack, we want you to be having carbs along with a protein source. So if you're having simple carbs from things like fruit or dairy, it's important to have some sort of protein along with that to help your blood sugar stabilize a little bit more easily. Simple carbohydrates are not bad. Again, they're found in things like fruit and dairy, along with other things that we do want to keep limited, like candy and soda. And then there are complex carbohydrates. Complex carbs are made of multiple sugar units, and they do digest a little bit more slowly. In this category, that includes fiber and starches. So foods like whole grains, legumes, starchy vegetables, nuts, and seeds. Again, it's not that simple carbs are bad, they just digest a bit more quickly. Complex carbs typically have a little bit more to offer in terms of fiber and things that can slow that digestion down. So it's good to have a combination of both and to pair that with a source of protein. So we're focusing on choosing more whole grains, fruits, vegetables, nuts, and seeds, limiting the sugary beverages, desserts, baked goods, and highly refined grains. Limiting, not eliminating, and using total carbohydrate counts to help guide us on how much wiggle room you have for those fun foods. Focusing mostly on carbohydrates that provide a lot of nutritional value along with them, and limiting the ones that are very high in added sugar and carbohydrate without a lot of nutritional value, like soda, for example. So how do we find that out? How do we know how many carbohydrates are in something? Again, for the purposes of this presentation, we're looking at a goal of about 45 grams of carbs per meal. So we're looking at this food label of something, let's say macaroni, and where we start on a food label is right here at the top where we see the serving size. The serving size is not an absolute that you must eat that much of the food, But per this amount, 1 cup in our case, here's what it is going to give you. So per 1 cup of this dish, you're going to be consuming 31 grams of total carbohydrate. You may decide that you want to eat this whole package, which is 2 servings, in which case you would just have to multiply this total number by 2. So you can eat as much of it as you choose, depending on what your goals are, but we need to be mindful of what this label is telling us is a serving, so we know how to accommodate if you have more than 1 serving. Now, where a lot of people get confused is underneath total carbs. You see here there's fiber, and below that there's sugar. So often as a dietitian, people are coming to me asking, I don't understand. Am I looking at sugar? Am I looking at added sugar? Am I looking at carbs? What am I looking for here? The total carbohydrate count is including these numbers that are listed below it. Like I said, fiber, sugar, and you might even see added sugar as another category. Those are all contained within the total carbohydrate count. So when it comes to carb counting, we always want a total carb. We want to stick with total carbs. Yes, different types of carbs may impact your sugar differently if they're higher in fiber, but for our purposes, for carbohydrate counting, we need to consider total carbs. Now, what if something does not have a food label right there in front of you? So often you can get online and access food labels, especially when it comes to fast food, restaurants, things like that. But let's say you're at a potluck or a cookout or somewhere. You do not have a label in front of you. You do not have the ability to look up the information exactly. Then we use kind of our next best, which is a way to kind of estimate about how many grams of carbs are in some of the foods that you consume. So this is based off of the diabetic exchange list, which breaks down different foods from different food groups to say, per this serving, there is about 15 grams of carbs in this food. And there are some examples listed in the bullet points on the left. So this is not saying only eat this amount. We'll look at rice specifically as an example. 1/3 of a cup of rice has about 15 grams of carbohydrates. You might look at that and think, oh my gosh, who is only eating 1/3 of a cup of rice? It's not saying that you have to. It's saying that per 1/3 of a cup, there's 15 grams of carbs. So if you eat 2/3 of a cup, you're consuming about 30 grams of carbs from that rice. And if you eat a full cup of rice, that's about 45 grams of carbohydrate. So again, if your goal is 45 grams of carbs per meal and you're getting all 45 grams of carbs from your rice, then we're not going to have any wiggle room for sauces and condiments that may have sugar or any starchy vegetables or a piece of fruit or something else that you may want to have at that meal. So knowing your carbohydrate goal and being able to estimate your carbohydrate intake gives you kind of a checks and balances system where you can choose, how do I want to spend my carb allowance at this meal? So again, these are some examples for some commonly consumed starches. 1/4 of a large baked potato, especially if you're eating at a restaurant or somewhere that often the potatoes are quite big, you might decide you only want to eat half of that. If you know 1/4 of it is about 15 grams of carbs and therefore half would be about 30 grams of carbs, it gives you an idea. It gives you some sort of frame of reference. So this is just good to be aware of, and there are categories for starches, fruits, dairy, etc., but it gives you some reference point. So if you have questions about carbohydrates and carb counting, please do not hesitate to type it into the Q&A or the chat, or we can talk about it at the end. But we'll move on from diet to some of the other lifestyle factors that can influence your blood sugar control. Physical activity. Exercise is incredibly important. The recommendation is at least 150 minutes of at least moderate intensity exercise per week. So that averages out to about 30 minutes, 5 days a week. And moderate intensity activity is something you can do with carrying a conversation, but you're exerting yourself enough that you're not able to sing. We call that the talk test. You can do it while talking. Maybe you're talking on the phone to a friend or walking with a friend, but you're exerting yourself enough that you don't have the lung capacity to sing. So something that's moderate intensity. So that might be brisk walking or something similar. So walking, swimming, cycling, anything that gets your heart rate up is, great exercise. We want at least 150 minutes of aerobic activity. Not only is this going to help contribute to better blood sugar control by improving your insulin sensitivity, getting that glucose to be used as energy, to be expended as energy. It can also help lower your blood pressure, help with cholesterol control, reduce your risk of heart attack and stroke, improve sleep quality, and even improve your mood and energy level. So exercise is important even if your goal is not weight loss. Often we associate exercise to burn calories, to lose weight, which is important if weight loss is your goal, but there are so many other reasons why exercise is important, especially for diabetes management. So again, 150 minutes per week of at least moderate intensity aerobic exercise, as well as at least 2 days a week of strength training is a good goal to work towards. With any sort of goal setting, we always want to meet yourself where you are and build your way up. So don't feel like you have to jump right into exactly these numbers, but it's good to know what to work towards. If you are overweight or obese, weight loss can help improve your blood sugar control by improving your insulin sensitivity, so your cell's ability to utilize the insulin. And maintaining a healthy weight also reduces your risk of heart attack and stroke. Weight loss does not have to be extreme. 5% weight loss can have a really positive effect on blood sugar control. So for a 200-pound person, that would be 10 pounds. You might have a personal goal that's more weight loss than that, but even that first 5% weight loss can make a difference. Okay, sleep. Sleep and stress don't get nearly the attention they deserve for how much of an impact they can have on your health. But getting enough sleep, which for adults is about 7 to 9 hours per night, can help support your immune system so you get sick less often. It can help you with your weight loss goal, especially because of the hormones that are released with lack of sleep or vice versa, that can impact your appetite and your cravings. Better manage your stress and improve your mood, lower your risk of heart disease, help improve your metabolism, and lower your risk of chronic conditions like high blood pressure, diabetes, etc. So there's only so much we can do to control our sleep, but making your best effort with things like following a consistent schedule, getting regular exercise, keeping your sleep environment conducive to sleep, putting down the phone or turning off the TV, having a dark, quiet, cool room, and limiting caffeine consumption or nicotine consumption before bed. Even alcohol can negatively impact your sleep quality. So if you're struggling with sleep, staying away from caffeine, alcohol, and nicotine can help improve your sleep quality. And then stress is a broad category. There's physical stress, something like injury or illness, and then, of course, mental stress. So both physical and mental stress can impact your blood sugar. Stress hormones like cortisol can reduce the effectiveness of insulin, and it can disrupt sleep, appetite, exercise, motivation or desire to do those things, motivation or desire to take your medication. Stress can wreak havoc. So, doing what you can to manage stress, again, physical activity can be a great tool for stress management. Practicing relaxation techniques like meditation, limiting caffeine, avoiding known stressors, and seeking support. So really think seriously about your stress because, as mentioned here, it not only affects you mentally, but very much physically. Okay, so we'll move on to the medication aspect. If your doctor has prescribed medication to help control your diabetes, it is so incredibly important that you are taking it as prescribed. that you understand what it does and why you are taking it, when you should be taking it. Do you need to take it in the morning or before bed, with food or without food, etc., and understanding some common side effects. So if you are prescribed medication, but you are not taking it, talk to your doctor. Understand what the medication is intended to do. Let your doctor know if you're not taking it, why. Otherwise, they just assume you're taking the medication and it's not working. The dose needs to be increased, or, a different medication needs to be added. So you need to be upfront and open about what you're doing and if you are taking the medication or not. If you are not taking it, having a conversation to help figure out if it is the best fit for you or if you need to go a different route. But medication can work in so many different ways when it comes to blood sugar control. So some medications help reduce the glucose production in the liver. Some help improve your insulin sensitivity or reduce the insulin resistance. Some of them help you eliminate glucose through your urine, so excrete excess glucose through the urine. And some of them can stimulate the pancreas to produce more insulin. Those are some of the mechanisms of medications that would be used for type 2 diabetes. Again, for type 1 diabetes, you will be on insulin. Insulin is the necessity. For type 2 diabetes, you may have oral or injectable medications and insulin, or some people are able to manage type 2 diabetes without medication. You may be able to manage diabetes through diet, lifestyle, adequate sleep, and stress management for a period of time, and then over time eventually need a medication or several as time goes on. So understand what your medication does and why you're taking it. Approximately 125,000 deaths per year in the United States are due to medication non-adherence. And I talk to people every single day who do not take their medication for one reason or another. Some of the reasons are high cost. If you cannot afford your medication, you can't take it. Confusion or misunderstanding. They don't know what the medication does or when or how to take it, so they don't, or they take it at the wrong time, or they don't take it with food, and then they have really uncomfortable side effects if it's a medication that's supposed to be consumed with food. So, hey, every time I take this medication, it gives me a really upset stomach. I stop taking it. But if they're taking it with food as prescribed, that can help mitigate some of those symptoms. So again, confusion or misunderstanding, complex medication schedules. If you're taking multiple medications at multiple different times per day, it can get a little bit overwhelming. You may just simply forget. You may be experiencing unpleasant side effects that you're trying to avoid, or you're dealing with depression or anxiety or other mental health issues that make it difficult for you to stay on top of your medication routine. So if you're having issues with medication adherence, it is incredibly important to talk to your doctor, and even sometimes talking to your pharmacist can help. There are options available for like pre-packaged doses, blister packs, medication synchronization, aligning things. So it means less trips to the pharmacy or more straightforward medication timing, using alarms, sticky notes, friends or family to help you remember, keeping it in a place that you're most likely to see it and actually take it. There are lots of different ways to help navigate that. But at the end of the day, if you're not taking your medication, talk to your doctor, help come up with a solution that makes sense for you. Okay, next up is blood sugar monitoring. This will vary depending on if you have type 1 or type 2 diabetes and your specific diabetes management plan that your doctor and you work on together. So you can test your blood sugar in a few different ways. One option is using a glucometer, which is what you poke your finger and put the strip in and use that drop of blood to get a blood sugar reading. And that's telling you your blood sugar at that moment in time. There's also a continuous glucose monitor, which is a small sensor that's placed under your skin. You see it on someone's arm typically, and that is monitoring your blood sugar every few minutes, providing continuous data that then you can access on a device or your phone. You can share that data with your provider, with your doctor, your endocrinologist, your diabetes care team. Your doctor may ask you to check your blood sugar once a day, several times a day, or suggest a continuous glucose monitor, just depending on your individual needs. Some people with type 2 diabetes don't have to check their blood sugar terribly often, especially if your blood sugar is well controlled. Your doctor may only advise you to check it once or twice a week, as opposed to someone with type 1 or type 1.5 who's relying on insulin to help keep your blood sugar under control. We're going to need a lot more frequent blood sugar readings. Often a continuous glucose monitor is a good fit for those individuals. It gives us a lot more feedback and data to work with. So that is individualized, but testing your blood sugar helps you spot highs and lows. It helps provide feedback for potentially adjusting medication, changing dietary patterns, being mindful of how exercise can impact your blood sugar, especially with type 1 diabetes, dealing with avoiding low blood sugar, which can be a factor, especially with exercise. So being able to spot trends and learn from what impacts your blood sugar readings, and also seeing how well your medication is working, tracking overall progress. So your doctor may be checking your hemoglobin A1C every 3 months, but that is only giving us a checkpoint every 3 months. So if you're not checking your blood sugar at all in between, and you're just going in blind, hoping for the best, that's not giving us a lot of helpful feedback or direction in the meantime. And also learning how outside factors like illness and stress can impact your blood sugar, some of kind of the less obvious things that are not diet and exercise related. So if you're struggling with blood sugar control, talk to your doctor. Your doctor may be willing to write you a prescription for a continuous glucose monitor and help you get that going. And this just goes over some of the blood sugar ranges. So you'll see here there are different categories: fasting, 2 hours after a meal, and your A1C. So fasting blood sugar, there are a few different categories. Normal, as in you do not have diabetes. So for individuals who are not diabetic, a normal fasting blood sugar, think checking first thing when you wake up in the morning, not having eaten breakfast, is under 100. The goal from the American Diabetes Association is between 80 and 130 if you have diabetes. So under 130 for a fasting blood sugar, unless your doctor has given you a different goal. That's the American Diabetes Association time or reference range, excuse me. And then there's also the AACE, American Association of Clinical Endocrinologists, has a tighter goal under 110 for a fasting blood sugar. I most commonly see that under 130, but again, your doctor may have a different goal for you individually. 2 hours after a meal, and this is after your first bite of food. So 2 hours after the start of your meal. If you do not have diabetes, a normal postprandial or after meal blood sugar reading is less than 140. If you have diabetes, typically the goal is less than 180. That is the reference range of what's programmed into the continuous glucose monitors for the in target range. Up to 180 is considered in target. You can adjust those goals, of course, if your numbers are different or if your goals are different. And again, the AACE goal is a little lower, under 140. And then A1C, which is basically like a 3-month look back of how well your blood sugar is controlled. This is measuring how much sugar is attached to your hemoglobin cells, hemoglobin being part of the red blood cells that carries oxygen. Those cells regenerate every 90 days or so. So this is about a 3-month look back. If your blood sugar is high, more sugar sticks to those cells and causes your A1C percentage to be higher. And if your blood sugar is very well controlled, less sugar is coating those cells, causing that number to be lower. So you'll see here, normal A1C for someone who is not diabetic is less than 5.7. And good control for diabetes, according to the American Diabetes Association, is less than 7%. That's typically what your doctor will advise. Your numbers may be tighter. You may have an A1C goal that's lower than that. Especially with type 1 diabetes, sometimes your doctor will look for tighter control. The AACE goal is less than 6.5%. So when you're talking to your doctor at your regular follow-up visits, at your appointments, making sure you're understanding how often you should be checking your blood sugar, what your goals are. So I talked about those target ranges, but specifically for you, what numbers are you shooting for? What's the best way to gather that data? If you're only checking once a day or a couple times a week, using a glucometer probably makes the most sense. But if your numbers are not well controlled or you need to be checking more frequently, multiple times per day, you may discuss whether a CGM is a good option for you. And of course, if your treatment plan needs to be adjusted. So based on your blood sugar readings and how things are going, talking to your doctor, having that open dialogue about what makes most sense for your future treatment, staying on top of your appointments and your lab work, all of those things contribute to good blood sugar control. But at the basis, it's understanding. What am I supposed to be doing? What should my numbers be? How often should I be checking? And the lifestyle factors, understanding carbohydrate intake, carbohydrate counting, etc. So I know this is kind of an overview, but if you guys have questions, please feel free to use the Q&A feature or to type in the chat so we can go into more detail if there's anything you wanted more information or clarification on. I'm not seeing anything come through. All right, I've got the Q&A pulled up and the chat pulled up, but if there are no questions, then, oh, I see here a question came through. Okay, so the most impactful lifestyle changes for someone who's newly diagnosed with diabetes. So assuming that's type 2 diabetes, I would say the most important things to address first and foremost would be implementing exercise. If you are not already physically active, if you're living a sedentary lifestyle, getting started with walking or whatever exercise you prefer, and starting to use that plate method to balance your meals. So you don't necessarily have to dive right into carb counting and counting every gram of carb you consume, but getting a more balanced plate and getting in more physical activity would be great first steps, first lifestyle steps. Okay, another question. Is it possible to reverse type 2 diabetes through lifestyle alone, or is medication always required? So that's a great question. Medication is not always required for type 2 diabetes. Type 1, of course, you will rely on insulin, but for type 2, you may be able to manage your diabetes with diet, exercise, and lifestyle alone, even for just a period of time, maybe for several years. You may eventually need medication again in the future. It's not an absolute. You will never need it again. But if you make some serious lifestyle changes, lose weight if applicable, increase activity, and eat a more balanced diet, and your blood sugar is well controlled, you may very well be able to get off medications and stay off them for a period of time, sometimes a very long period of time. Good question. So lifestyle plays a much bigger role in type 2 diabetes, but of course can contribute to your blood sugar control with type 1 as well. And then how often should someone with type 2 diabetes check their blood sugar? So that really depends individually. If you are newly diagnosed, you may start by checking at least once a day, either a fasting blood sugar or before bed, at some point after a meal, starting by just getting kind of a picture of what's going on. Your doctor might advise you to check more frequently or less frequently. So, again, that's kind of individualized, but checking at least once a day would be a good start for someone who's newly diagnosed. And then those levels for the fasting blood sugar, less than 130, after meals, less than 180, before bed, less or about 140. We don't want it to be too low before you go to bed, but those are some different times of day that you might check. And unless your doctor gives you different direction for frequency or reference range for what your numbers should be, those are the numbers I would shoot for. Okay. And then resources or support systems. So there are a lot of resources available online, of course, but we want to make sure we're using reputable evidence-based information. The American Diabetes Association is a great resource for information, recipes, etc. And the CDC is also a great resource for information, reference ranges, um, accountability tools, lots of different information on those two sources. So again, the American Diabetes Association and the CDC are really good resources. Good question. Okay, any other questions or anything that you guys want to talk in more detail about or clarify? Feel free to type in the chat or the Q&A before we wrap up. All right. Well, if there's nothing else, and I appreciate you guys being here and hope that this information is helpful to you or gave you more insight on some of the things you may be dealing with diabetes management. And feel free to reach out if you have questions. Thank you. Oh, I just saw a question come through. Okay. Sometimes my wife after food increases more than 180. Okay, so blood sugar after eating is greater than 180. Can we reduce? So without a ton of context on exactly the situation, I'm assuming this person maybe has, your wife maybe has type 2 diabetes. Um, Checking blood sugar after a meal, seeing that it's greater than 180. Can that be reduced? Yes. What's happening at that meal would need to be taken into consideration. So if right now she's already consuming, let's say, a low carbohydrate diet, and despite cutting back on the portions of carbs or total carbohydrate content, her numbers are still getting higher than 180. I can't give specifics for exactly how many carbs, but cutting back a little on the total carb count or starting to count carbs if she's not already would be great. And going for a walk after eating can have a huge impact on blood sugar control. So even going for a 10 to 15-minute walk after dinner or whatever meal it is that you find your blood sugar kind of stays high despite having a balanced meal and counting your carbs and doing everything that I talked about, getting a little bit of movement after eating can be helpful. So you mentioned you're using a CGM to monitor. Is she already counting carbs now? And if she's not already, counting or accommodating for her carbohydrate intake, I would say that would be a really good place to start, starting by getting a good picture of what she's doing now, about how many carbs she's consuming currently, and then going with a little bit less. So let's say maybe right now she's having 45 grams of carbs, like I used in our example, um, cutting back a little to, let's say, 35 grams of carbs at a meal and getting a little bit more activity, could do the trick. We do not count carbs. Okay, so yeah, starting by getting some practice using food labels, that exchange list that I mentioned, or if you have access to or the ability to work with a dietitian, often when people are newly diagnosed with diabetes, they will have an opportunity to work with a dietitian and learn more about carbs and carb counting. If you have that opportunity in some capacity, definitely take it. Working with a dietitian can help go into more specifics and more details about some of the things I touched on during the presentation today, like how to read the food label and how to use that exchange list for estimating carbs. That would be a great place to start, though, using those food labels and that plate visual, where about half the plate is non-starchy veggies, a quarter of it is a protein source, and about a quarter is a starch or carb source. That would be a great place to start. Great questions. I'm leaving it open here to make sure I don't miss anything. We do still have about 8 minutes left, so if you guys have a question, don't be shy. Okay. I know it's hard without having specifics about your specific carbohydrate needs, but again, if you are able to work with a dietitian, if you have that opportunity, please take it because that's exactly what we do. That's what I do every day. Help people understand carbs, carb counting, carb needs, how to adjust their carbohydrate intake based on their blood sugar readings or their CGM data. Okay, great. I'm not seeing. Okay, using keto bread, low carb, but blood sugar still more than 180. Yeah, so it's kind of hard to say without, being able to look at her specifics and knowing, the full picture. But if despite low carb intake and getting in some physical activity after meals, it's still staying high, again, either working with a dietitian, which would be great, or talking to the doctor about continual adjustment and medication management would be a potential next step as well. But taking into consideration total carb count of the meal would be the most important factor. So even with like a keto bread or low carb bread, depending on the entirety of the meal, that could kind of depend. That could depend. You're very welcome. Thank you for the questions in the chat. I appreciate it. And I appreciate you guys being here. If more questions come up, feel free to reach out. The email address that's listed here, asktheRD@myehcs.com. You can send questions if they are kind of specific questions about your individualized needs that might require, one-on-one services. But that's what we're here to do. We're here to help. Working with a dietitian is the best way to get a better understanding of your diet and lifestyle factors and how that can influence your blood sugar control. So thank you guys again for being here. And I'm not seeing anything else pop up in the Q&A. So I'll go ahead and end the meeting now, and I'll keep an eye out if anyone reaches out in the future. Thank you guys. Sorry, my computer just